Welcome, everybody, to our July meeting. Thank you so much for joining us today. This meeting is being recorded. We are absolutely thrilled to have one of our own speaking today, presenting on a very, very important and timely issue for nurses. We have Annie's own policy analyst, Sarah Buchik, here to present removing PFAS protections in drinking water, implications for nursing. Just a little bit about Sarah before we get started. Sarah is, as I said, our policy analyst here at Annie and is highly engaged with Annie's work on toxic chemicals. She has been an RN since 2001 and has worked on successful state level legislation centered on lead poisoning prevention in children. She co-authored Annie's PFAS guidance for clinicians and has taught undergraduate nursing students both in the classroom and in the community. Sarah holds a master's degree in psychiatric mental health nursing from the University of Pennsylvania and a postmaster's from the University of Maryland in community and public health nursing. Welcome, Sarah. Thank you so much for speaking with us today. I'll let you take the floor.
Thanks so much, Millie. I appreciate it. Let me go ahead and share my slides. Can you see my slides? Okay.
Yes.
Yes, I see them.
Sorry, one second. I apologize. Those are my slides, but without my notes.
No worries.
Okay, great. We will go ahead and get started. All right, as Millie said, my name is Sarah Buchich, and I'm going to briefly talk about today what we're doing at Annie to educate clinicians around PFAS and discuss some of the resources that we have coming up for both providers and for patients. I'm going to discuss our revised toolkit for clinicians. This toolkit has really come from people asking a lot of questions to us, people hearing things from patients. So we really try to use the feedback we get here at Annie to when we updated the toolkit recently. So let's jump right in. There's a lot of rollbacks and things happening now with PFAS. So today's presentation, like I said, I'm going to go over PFAS. We're going to talk about some of the current proposed regulations. I'm going to do a very brief overview of PFAS. I'm not sure everybody's knowledge base on the call, but I just want to make sure everybody understands what we're talking about. I'll just do a very high-level overview. And then we'll talk about some resources for nurses, and then definitely opportunities for action, because there are plenty when it comes to PFAS. So just what are PFAS? They are a group of poly and per and polyfluoroalkyl substances that make up a group of over 12,000 chemicals. And they're used to make fluoropolymer coatings and products. And they are in a lot of things that we use. They are used because of their ability to resist heat, oil, stains, grease, and water. And there's actually more than 600 PFAS chemicals being used in commercial products in the US. PFAS are stable due to the carbon-fluorine bond, which are some of the single strongest bonds in chemistry. And this is what makes them really difficult to break down and makes them very persistent in the environment, which is what makes them forever chemicals. So as you can see from here, fluoropolymer coatings are used in many different products, such as heat-resistant nonstick cooking surfaces, waterproofing and stain-proof clothing, food packaging, adhesives, furniture, paint, personal care products, cleaning products. The list goes on and on. Many food consumer products contain PFAS chemicals, such as fast food containers, wrappers, microwave popcorn bags, pizza boxes, candy wrappers, personal care products like shampoo, dental floss, nail polish, eye makeup. The list goes on and on. And so this is why it's really important when our patients come to us and ask us about PFAS that we want to be able to explain to them where they're getting exposed. One of the primary routes, though, is through drinking water. So that's what we're going to focus on today. Like I said, there are a lot of sources of exposure. This can include the main way that we get exposed is through ingestion. So this can be food, fish, or shellfish grown in contaminated water or soil, through the food packaging materials, like I mentioned, and it can be found in soil and water wells and in the public drinking water systems, which is what we're going to talk about today, the National Primary Drinking Water Rules, which are right now at EPA, and it's open for comment. So PFAS chemicals, like I said, can be found in soil and private water wells, and this is largely due to historic contamination from manufacturing, from the use of firefighting foam, which is used at airports and military sites, and it can also leach from landfills. It can also, PFAS exposure in a person can also come from working in an industrial facility where PFAS chemicals were produced or where, they have occupational exposure risk is high. For infants and toddlers, additional exposure sources can be through formula when it's mixed with contaminated water. It actually can also be found in breast milk from people who have current or past exposures to PFAS. And infants and children can also be exposed to that hand-to-mouth behavior that we know small children have. Surfaces, they can get it on their hands from surfaces treated with PFAS-containing products and then put it in their mouth. There's also PFAS can be, you can have PFAS exposure through contaminated dust in the air. And you can also have transplacental exposure with some PFAS actually shown to cross the placenta and enter the umbilical cord blood. As I said, breast milk can be a source of exposure, and our whole toolkit is based on the NASEM's clinical guidance. And they state that the breastfeeding outweighs the risks. So we always want patients to speak to their provider. But that is another source of exposure. So just to take a step back, most people in the United States have measurable amounts of PFAS in their blood. And you can see on this graph here that as the production and use of PFAS and PFOA, you'll hear me say those a lot today, they're two of the most common types of PFAS, that it has declined and some blood PFAS levels have decreased as well. So the EPA has actually established a health advisory level for these two, for PFOA and PFAS. So we have a health advisory level of 4 parts per trillion of these two types of PFAS. And these health levels are recommended based on the best available science and current technologies, and they're the lowest level that can be measured in water. It's important to remember when we talk about PFAS that there's about 12,000 different PFAS. There's really no safe level determined, and certainly not for PFOA and PFAS. There's no safe level of PFAS. While the federal government continues their conversations about how to implement these advisory levels, some states are actually taking action, and we'll talk about that a little bit today as well. So the main thing, this is why it's really important for us as nurses, why are they harmful? Well, as I had mentioned before, they don't break down in the environment, and they can actually build up and accumulate in our body over time. And they're linked to adverse human health effects by targeting multiple organs in the immune system. So when PFAS chemicals are introduced into the environment and drinking water, it can become contaminated. And, if it can build up in fish, and then if we consume those fish or plant vegetables in soil where there's PFAS, we can end up ingesting it. And there are many harmful effects of being exposed to PFAS chemicals, which we'll get to in just a second. It is detected through blood testing. We'll also talk about that today as well. And yeah, let's jump right in. So this is from the NASEM clinical guidance, which was produced in 2022. And so one of the things with PFAS is, people are waiting for science, and there's a lot of unknowns, but there's also a lot of knowns. There are things we absolutely know about PFAS, and we can take action on those right now. So even though not all effects of PFAS are known yet, current research shows sufficient evidence that being exposed to PFAS can increase cholesterol levels, it can increase the chance of kidney and testicular cancer, it can decrease vaccine responses in children, and it can alter liver enzymes. So this is sufficient evidence. We have research on this, and these are knowns. The NASEM report also talked about, there's limited or suggestive evidence that there's an association for other types of issues with PFAS, like breast cancer, other liver enzyme alterations, increased risk of pregnancy-induced hypertension, thyroid disease and dysfunction, and ulcerative colitis. So there's also been, since the 2022 report, there's also been some additional epidemiological evidence suggesting an association between PFAS and testicular cancer. So we want to make sure that we are doing screening for those who have had military service and who might have occupational risk as a firefighter. And there's also ongoing research into the neurodevelopmental effects of PFAS exposure. So again, there's a lot of things that are still emerging with the science, but there's suggestive evidence of these health outcomes. There are still gaps for these things that you see on your screen, meaning that they're people are looking into them, but there's, as you can see, they really run the gamut, and there's a lot of different issues that PFAS can lead to. But there's ongoing research, and that's something we just want to stay on top of as a clinician. So as you can see here, 45% of the nation's tap water is estimated to have one or more types of PFAS. And if you scan this QR code, it takes you to this interactive map, which you can just plug in your address and look at where you live. And one of the things in our toolkit that we really stress is, as a nurse, if you're practicing in a community, you want to know like what's in that community, because there are communities across the country that have been informed that they have high levels of PFAS in their drinking water. Especially those around military sites, or if there's been historic use of them in manufacturing. So there are communities across the country that have already been determined to have elevated levels of PFAS. And this is just a great resource for wherever you're practicing, if you're in a hospital, if you're out in the community, just to plug that in to kind of see what you can expect to see coming from your patients, because people are made aware of these. There have been through the regulations passed by EPA, there were a couple things in there where if they passed certain levels of PFAS in the water, there was an exceedance that there was to be public communication. So as the federal government makes these PFAS regulations, there's usually requirements that the communities have to be notified, and we can certainly anticipate questions from our patients as a result of that. All right, so here's where we get into it. In addition to all the things that our toolkit covers, we really encourage nurse advocacy. And this has never been more important than in the case of PFAS, in my opinion, because PFAS, there's so much still we have yet to do. For example, we don't have insurance covering PFAS blood tests yet. So in the state of New Hampshire, you can get a PFAS venous blood draw covered by your insurance. Maine has just passed some legislation to start doing that. But in the rest of the country, it's payment out of pocket. So this is a huge gap, and it's a place where nurses can really raise their voices and get involved. We don't have FDA limits for PFAS in bottled drinking water. So that's something that nurses can get involved in. And our toolkit really goes through all of the different things that we really need to have for PFAS. We need to have OSHA limits, and to finalize chemical data safety rules. Right now, the federal government in Congress has two separate bills that are looking at rolling back the Toxic Substance Control Act, and that's one of the mechanisms at the federal government that can help us, make sure that PFAS aren't continuing to end up on the market. So ultimately, we really want nurses to get involved and to advocate for equal testing of PFAS exposure, so that our patients can actually get those tests that they're asking for, and that we can actually, start to treat it like we do with other issues, where we can have a blood test and interpret those results and decide on a plan of care. So the states, as I said, are moving in the absence of federal regulation. So this is really something that we are working on at Annie right now. So there's a group called Safer States, and we work closely with them. You can see on here that since 2001, 30 states have adopted 193 PFAS policies. And many states have introduced, 33 have introduced PFAS policies that may not have been adopted, but have been discussed and introduced. So this is kind of a really critical area. A lot of folks are looking at what's happening at the federal government, and there's a lot of things being rolled back and things that are stalling, but there's a lot of opportunity at the state level to still make a lot of really critical changes. So one of the biggest things that we can do is, healthcare provider education. I know for myself, I did not learn about PFAS in school, but in talking to newer graduates, I know that this is still, something that it's an emerging issue. So it's not really talked about the same way as other issues yet. So we need ongoing education. The states can actually set their own drinking water protections. And then we can also advocate for funding as nurses. We all know that if something doesn't come with funding, that it often doesn't happen. We also want to be able to talk to our patients about prevention, all those things I said at the beginning, all those different sources of exposure. We want to be able to, communicate those things. And we also want to advocate for public health tracking systems and promote safer alternatives. And of course, absolutely, that that insurance coverage for PFAS blood testing, which is a huge barrier right now. And also what's happening at the state level, and there really is a lot of confusion. We want to regulate PFAS as a class. There's over 12,000 of these, so we don't want to be regulating them one by one. So you'll see the regulations that we're talking about today. The Biden administration focused on regulating 6 PFAS, and 4 of them are looking at being rolled back, and 2 of them will be retained. And anything with this one fully fluorinated carbon atom, we want that to be regulated, because PFAS are PFAS, and just kind of regulating these one at a time, we will be here for a very long time doing that. So okay, so this is kind of what's coming up next week. I'm just going to give you some background of how we arrived where we are. In spring 2024, the EPA announced that there was going to be a final national primary drinking water regulation, which was really the first of its kind, a national and legally enforceable, scientifically supported standard, which would, prevent PFAS exposure in drinking water for about 100 million people. It is expected, it's still in place. It's looking at being rolled back, but as of this moment, it's expected to prevent thousands of deaths and reduce tens of thousands of serious PFAS attributable illnesses. At the same time, in the last administration, the EPA had also made unprecedented funding available to help ensure that all people have clean and safe water. So EPA had announced $1 billion in newly available funding through the bipartisan infrastructure law, which I know a number of you have probably heard of, to help states and territories implement the PFAS testing and treatment in these public water systems, and also to help owners of private wells address their PFAS contamination. So the IRA, or the Inflation Reduction Act, allocated also $5 billion for PFAS and other emerging contaminants. So there was an incredible amount of policy that happened under the last administration, as well as funding that followed it. Unfortunately, where we are right now is a lot of those things have been discontinued and are being rolled back. So last year, we did hear that the Trump administration had planned on taking those 6 PFAS that were originally regulated in 2004 and removing 4 of them and just keeping the 2 of them, the PFAS and the PFOA. So we know that that rule is going to be, it's proposed to be weakened. And there's also a plan to delay the compliance so that water utilities would have additional time. On top of this, we also have the bipartisan infrastructure law that I just mentioned on the last slide, that $1 billion. This year, 2026, is the last year that that funding is available. So that $1.8 billion that addresses PFAS and emerging contaminants in public water systems, that's all going to be gone after this year. There have been a lot of funding cuts. I'm sure a lot of you have heard. How it affects PFAS is there's been $15 million in PFAS research that has been cut. This was research that studied contamination of farmland, crops, and livestock. Sometimes if you read about PFAS, you'll read about PFAS in agricultural sludge. So there's a huge concern in the farming community about PFAS exposure and getting into crops. There's also been a 23% proposed funding to the EPA overall. So we're down about 733 employees at the EPA. So the federal budget proposal includes a 55% cut to EPA and funding cuts for states and communities. 88% of that is expected to impact local PFAS work directly. I'm not sure if some of you heard, but the Office of Research and Development has also been eliminated, and most of its funded scientists did EPA's research on PFAS. So in addition to the regulations that are currently open till July 20th, and there's a hearing next week for these regulations, we have these huge funding cuts happening at the same time. So this is really significant. So these are the 2 federal rules that we have currently open till July 20th. As I said, that first ever national primary drinking water standard from 2024 is now at risk of being rolled back, which will place millions of those in the US at risk for serious health effects. As I said, kidney and testicular cancer, breast cancer, ulcerative colitis, thyroid disease and dysfunction, and increased cholesterol levels. PFAS regulations are really being undone at an exponential rate as well. It's outpacing the years it took to get all of these, community-driven regulations in place. And the communities impacted by PFAS worked really hard for these regulations. When we first created our toolkit, we've gotten to speak with communities across the country, and these communities are really working tremendously hard to push forward policy, and these are really just being undone. And it's going to have huge health harms, and it goes against over 50 years of scientific research that we have on PFAS, because EPA has known for decades that PFAS endangers human health. So this first rule here, the PFAS rescission or the rollback, it's looks at repealing 4 of the 6 PFAS from those drinking water standards. Many communities, the 4 that they're removing, the EPA had proposed something called a hazard index. So it would take those 4 PFAS and kind of look at them in combination with one another, which is really kind of revolutionary because it's kind of like a cumulative impacts approach in some ways. And we know that many communities are exposed to and harmed by these mixtures of PFAS in their drinking water, which is why that 2024 rule included that hazard index. And it was really critical. And a lot of those who work in the cumulative impact space were really excited about it because it was really a recognition that, things aren't just happening one at a time. Our bodies and our communities are all being exposed to many things at once, and those can have different effects than just one chemical at a time. So that decision for the EPA to include that was so important, and that will be removed if this proposed federal rule goes through, this rescission. So the second thing that is open right now, the proposed rule, is the compliance time delay. So the compliance time for PFAS and PFOA is already set at the maximum. We know this. The Safe Drinking Water Act states that the most time the EPA can allow for water systems to come into compliance with a drinking water standard is 5 years. And the 2024 rule already allows water systems until 2029 to come into compliance. So by trying to extend the timelines for water systems to comply, that really violates the law's 5-year cap. And in addition, the Safe Drinking Water Act has this thing called an anti-backsliding provision, which actually prohibits actually the EPA from weakening drinking water standards once they're finalized. So rolling back these drinking water standards is really unlawful, and it's under the Safe Drinking Water Act. But it is currently being proposed. So these 2 regulations are what we're really encouraging nurses to weigh in on. I will put the links in the chat. I know some of you have already registered for these hearings. The last day to register for the hearing next week was yesterday. However, good news, you can submit your written comments until July 20th. And we have a whole set of talking points that you can use. But what we're really encouraging nurses to do is really just talk about, how this impacts your patients. You don't have to be an expert on the PFAS aspect of it as much as, are you having patients coming to you and asking you questions? And are you able to, provide them with sufficient answers? We really want our communities to have safe drinking water. So this is something we really rely on. As nurses, we're educating ourselves. We're trying to educate our colleagues, but we rely on the EPA to really help us with that other part to keep drinking water clean. And so this is a huge threat to PFAS work. Just to go back to the toolkit, because there are things in the toolkit that can also kind of help you if you're looking to provide comments or you want to get more involved in advocacy around this. The toolkit provides things about talking to patients and communities. It talks about clinical testing, how to interpret those lab results, how to provide clinical management, and how to provide that clinical follow-up. And really just provides a lot of really, really good information. And I encourage you to take a look at it. It's based on, like I said, that NASM guidance, which is from 2022. And it also includes a 12-question PFAS exposure assessment and questionnaire. And this is something that's really important because, as I said, those PFAS blood tests aren't necessarily covered by insurance in 48 states, or it's still 49, I think. But until Maine gets that, most states don't have that insurance coverage. So we have this exposure assessment questionnaire that you can really sit down at the bedside or out in the community and do this questionnaire to kind of, just see if this is the path that you want to go down with PFAS blood testing. In the toolkit, there's also clinical testing recommendations, and one of the really, I guess it's good in the sense that these are all things that we can continue to follow. So a lot of times people will say, well, why are we going to test something if there's nothing we can do about it? Well, there's a number of things we can do about it in the sense that if you do have PFAS, you can learn about prevention and you can reduce those levels that you're being exposed to. And secondly, there are a lot of things that if you have PFAS in your blood that you are at risk for. And most of those things are routine exams that we can incorporate into a plan of care. So, things like making sure somebody gets their cholesterol checked and making sure somebody's getting, their cancer screenings. So these are kind of, these are things that we can do. And so I think it's incredibly empowering if we're able to provide people with information and follow up on things that they might be at higher risk for. I just wanted to put out this here. I always like to plug the PESUs. If you're not familiar with them, they are the Pediatric Environmental Health Specialty Units. They're an incredible resource, and I always mention them just because whenever I mention them, a lot of people haven't heard of them. And in each EPA region of the country, there is a Pediatric Environmental Health Specialty Unit that works, specifically to help children and families navigate environmental health exposures. And this is a great resource because we know that everybody can't be, a PFAS expert, but this is a group of people that you can call, and not just for PFAS, but for any kind of environmental health concern. There's amazing resources here, and they can really help direct you if you have questions. So just want you to bookmark that website if you don't have it bookmarked already. They're really great resource. This is the link to the toolkit, but I want to answer any questions if people have them. I hope folks have questions. I covered a lot in a very short period of time. I'm sorry I spoke so quickly. But yeah, Millie, are there any questions in the chat?
There is nothing in the chat at the moment, but I am sure there are questions, so many questions. So come on. Now is the time. You don't have to come off camera. Yes, here we go. From Christina Sellers. Does RO filtration remove PFAS?
Can you explain a little bit more RO filtration? I'm
Christina,
sorry.
if you could just unmute. Um,
Yeah, sorry. I am I'm trying to keep an eye on my kid in the other room too. Can you hear me?
Yes, yes.
Okay. So reverse osmosis.
Oh, okay. Yeah. I'm sorry.
That's okay.
um, our toolkit has the National Science Foundation. There's a link in there that you can plug it in. So as you probably saw, there's that 4 part per trillion. Some of the water filters, it lists the different filters in there and what regulations they,
Okay.
ascribe to. But I will put that link in the chat. I'm glad you asked that.
Okay.
Because there's a lot of filters out there, and it's really important that you make sure that they're actually filtering for what they say they're filtering for. So yeah, I'll put that link in
Right.
the chat.
Okay.
I'm here talking to myself when I muted myself. Thank you for that question, Christina. And I do see, well, Christina, our co-chair, she left a recommendation. A good book to read or listen to is They Poisoned the World, Life and Death in the Age of Forever Chemicals by Mariah Blake. So any recommendations uh, or links that are in the chat, I will be sure to pick up and put into the group forum. So if anyone else has any recommendations, please do leave them. They will be shared. Amanda D, hello. She asks, do we know exactly how much PFAS is in bottled water?
So I'm not aware of studies that are measuring PFAS in bottled water, but there are no regulations for it that I'm aware of. So to my knowledge, there's not any limit to that right now.
Oh, geez.
But I'm not sure about studies. That's a good question.
That
To see also how the different water brands would maybe have different amounts.
Ooh,
And it's also difficult too, because if you're thinking about like a plastic water bottle, there could be some, it could be from the water source, or it could also be from the container. So that's an excellent
my
question that I
goodness.
don't know the answer to.
Oh, wow. Good question, Amanda. Thank you. Debbie Hogan, if the rollback occurs, what actions will have the best effects?
So the best, I think I understand your question. So if it does go through and we're only going to monitor for those two, I think that's really one of the reasons why we want to have those state level protections. There are states that have taken the EPA guidelines and recommendations and the final rule, they're not actually recommendations, the rule, and made them their, state MCLs. So I think having those solidified at the local level is really critical. There's a lot of concerns too, because in the policy space, there's a number of laws right now that are looking at prohibiting states from doing such things.
Mhm.
But at this time, it's still allowed. There was some discussion of that with the Farm Bill. There's also some discussion of that with the Toxic Substance Control Act, trying to put in there some ways that these states can't, enforce stronger rules than the federal government. But as of right now, that would be, in my opinion, the best thing is to enshrine those in the state law.
Debbie, did you want to expand on that? I did see your hand up or add on any comments.
Hang on, I'm just trying to get, sorry. I'm sorry, because I didn't mean to be negative, but there's so many things being rolled back these days. So, and I know so many communities and states have kind of taken their own lead. So that's what I wondered. Okay, so we're going to try and advocate, but at the same time, should we be ignored? Um, uh, then where can we begin? So I do absolutely agree that states should not be prohibited. That is something that my state of Florida has done. That the law has, when different communities have set something up to protect their residents, the state has forbidden them from doing it. It seems so cruel.
Yeah.
But anyway, I absolutely see that, yeah, it's important that states can do what they can do. And we know that at least 30 of them have taken the initiative. So, okay, hopefully that will sustain. Thank you.
Thank you. And I see Clara has their hand up.
Yes, thank you for your presentation. My question is if you could expand a little bit on the type of labs that are more specific to, to find this type of chemicals that could be incorporated into, medical care or nursing care.
Okay,
Thank you.
sure. Thank you for your question. So, as far as PFAS testing, we in our toolkit we have, the lab codes and everything for that. As I mentioned, there is a cost to that, unless you're in specific states. So there are also policies in place, not policies in place, policies proposed at the national level to try to get those kind of tests covered for example, people on Medicare. So those tests are very straightforward in the sense that once we run a PFAS blood test, you'll get a certain number. And there are actual, in the toolkit, you'll see this based on NASM guidance. If it's between, 2 and this, like we have different ranges of PFAS. And based on what those ranges are, there are recommendations associated with those ranges. So if you look in our toolkit, and I'll leave the link for that in the chat, we have a really nice chart pulled from NASM that just says, once you get these lab results back, this is what you're going to be looking for. So it's really, it's actually really empowering because it's real information and we can do something with it. So it's pretty exciting.
Thank you.
Hope I answered your question.
Yeah.
Wonderful. Thank you so much. Any other comments or questions? it sounds, and Sarah, just tell me if I'm wrong. This sounds like yet another example of where maybe our influence on the federal government in this space may not be as strong as it used to be. It isn't. But at the state level, we can certainly advocate strongly for our states to do the right thing, get the right policies in place, and cover for the type of testing that needs to be done.
Absolutely. And I think there's a lot of different ways to approach it. We're obviously not going to back down from trying to make our voices heard at the federal level, but just also preparing for if that does go through, that we should have a backup plan. So I'm going to put in the chat these two separate hearings. There's two hearings happening on one day next week. Don't let that confuse you. It's very confusing. I've not seen that before. But they're very similar. They're both about the same rule. One is for the rollback and one is for the delay. So if you've signed up for these hearings, you're going to receive two separate times. But like I said, even if you haven't signed up for this, you can submit comments through July 20th. And it's really important that you speak your mind and also just use your own language, because right now, a lot of times if we submit form letters, they will not count those as separate comments. So it's really important to personalize and really say, I'm a nurse and I practice in this area, and this area has already been, determined to have elevated PFAS levels, and this is what I'm seeing. That's incredibly valuable, and it goes in the permanent record. So also, should things in the future change and we have a different administration that looks at this again, all of those comments are still there and they're part of the permanent record. So I think it's never a waste of time to put our name on there if we are able to, and to say our piece.
And those that last link that you put that says rescission and delay talking points, that whatever comments are written up by individual nurses, you can draw from those talking points to help form your letter as well.
Absolutely. Those are just kind of a framework. You can pick, just a couple of those, and really just make it in your own voice. Absolutely.
Excellent. Excellent. All right.
Oh, thank you, Debbie.
Any other questions or comments? Any other links on resources anyone would like to share? Now is the time to do it. Again, we so appreciate your educating us today, Sarah. I'm sure that as things advance, we'll probably be pulling on you to give us updates, maybe in 6 months or so. Thank you for your advocacy and for really showing the way for individual nurses to join on to this.
I
Oh, and
appreciate
thank
the
you.
opportunity. Yeah, and I put my email in the chat. We are beginning to do some state level advocacy. So if you are interested in getting involved in that, please do reach out to me. There are a lot of bills moving in a lot of states, especially in the from January on, but there's still a couple states that are still going all year through, and there's definitely PFAS legislation happening. And most states now, you can either submit testimony virtually, and you can always submit testimony written. And we do have opportunities at Annie. Sometimes we get asked if folks want to participate in a press conference or something really to elevate, a bill that's coming out. So if you're interested in anything like that, please let me know. I know I've talked to a couple people on here about events like that before, where we have opportunities, writing op-eds and all kinds of things like that. It's really interesting, and you get to meet a lot of interesting folks and really elevate the nursing voice. So
And it's important to note again that we don't throw you in.
No.
You are really well supported and guided.
Yes.
informing your own words. So we work with you as an individual to get your point across. So don't let any kind of fear be a hindrance, whether it's fear of writing, or fear of speaking. We will support you every step of the way in as much as you need to be supported in the way that you want to, whether that's in the written word, through op-eds, or at press events. We're here to support.
Absolutely. Yes, you will not be left alone.
You'll be telling us, go away. I don't
Yes, I was going to say it'll probably be the opposite.
Make myself choke.
Dark Water is an excellent movie. Thank you, Christina. Yeah, I got the opportunity to attend the National PFAS conference, and I know that Rob Bilott was supposed to attend. He had another thing that came up, but it's an excellent movie about a real situation and kind of how, some of the origins of how we started learning about the PFAS issue publicly.
I wonder.
Oh, sorry. I was just going to say I really love his story because it took like a decade to happen to fight against DuPont and to win, win for his clients, for the community that was suffering from all sorts of ailments from the exposures to Teflon. So I just wanted to, in light of our current situation, just give that little, there's that little bit of hope within a dark battle. So just trying to keep myself buoyed as well and just keep fighting. So wanted to share that. It was a good story.
That's
Thank
an
you,
excellent,
Christine.
excellent resource. And I throw this out as a question for the group. I wonder if at some point we could have a showing of one of these types of movies, if they're appropriate and more like documentary type, for our group, and see how community members can come together around discussions around that. These are all, I'm planting seeds. Oh, thank you, Amanda. Planting seeds of engagement. This group is a very powerful group within the only nursing organization globally, anywhere, that focuses exclusively on environment and human health. So that means that you are the only forum anywhere of nursing professionals that is equipped with all the tools and support of our organization behind you to take action, to take that first step forward. And so it is important to continue the engagement. It's important that we bring to you what you need to have that support. Fantastic speakers like Sarah, your co-chairs who offer resources. And please don't be shy on suggestions and recommendations. We are here for it, and we grow as you grow. So thank you again. Is there any parting words from our co-chairs? Unless you're still eating and do not want to come on camera. If not,
I was just going to say thanks for a great presentation, Sarah, and excited to speak at the hearing next week.
Yeah, I can't wait. We're really excited that some of our nurses have signed up to speak, and we're going to be listening and getting some quotes and, and sharing those around, because the nursing voice is really critical in this issue. And for 25 years, we've been the most trusted profession. So it's a quarter century. And so I think we need to continue, elevating that around PFAS.
yeah, translating trust to influence, right? And this is how you do it. These are the steps. All right. Going once, going twice.
Thank you all so much.
We're seeing congratulations and clappings and hearts. All right. So if there is nothing else, if there are no comments, again, I will leave this recording in the group forum with any resources. Please feel free to reach out to Sarah or myself or the co-chairs if you have any questions. If you're like me, you hang up and suddenly 3 o'clock in the morning, the question that you would have asked suddenly occurs to you. Please don't hesitate to reach out. Thank you, thank you, thank you, Sarah. Thank you to everyone who joined us today. I'm going to go ahead and end the recording, but the conversation certainly hasn't stopped.